Hello, my name is Christina McRae. I'm a student physical therapist assistant from Jefferson State Community College. Today I'm going to talk to you about acute respiratory distress syndrome. It's commonly known as ARDS. ARDS is a life-threatening lung condition that leads to low levels of oxygen in the body. It deprives major organs of oxygen-rich blood that is necessary for sustaining life. It's a condition that usually occurs secondary to a major accident or injury. Some of the common causes of ARDS includes aspiration of vomit into the lungs, pneumonia, sepsis, trauma occurring to the head or thorax, inhaling chemicals or particles, lung transplants, and multiple blood transfusion. To first understand how ARDS works, we have to understand how the lungs work. So I've included a diagram for you to follow along. It's kind of a respiratory refresher. First, the body inhales oxygen through the nose and mouth via respiration. Air travels to the lung sacs known as the alveoli. Alveoli contain small blood vessels called capillaries, and the oxygen passes from the capillaries to the air sacs, and this is where oxygen or gas exchange occurs. The capillaries then pass the oxygen to the bloodstream where it's circulated throughout the body. What ARDS does is it interrupts the process by increasing the capillary membrane permeability, and it allows protein-rich fluids to accumulate in the alveoli, and this will disrupt the gas exchange. It results in organ failure and brain death if early interventions do not happen. The brain can only sustain just a few minutes without oxygenation before irreversible damage occurs. Complications can include pneumothorax, lung scarring, and blood clots. Death is common with ARDS and usually occurs from multiple organ failure or sepsis rather than due to a pulmonary issue. Symptoms of ARDS includes difficulty breathing that's usually characterized by rapid and shallow respirations, low blood pressure, tachypnea, shortness of breath, low levels of O2, and the patient usually exhibits extreme fatigue and tiredness. Diagnostic testing is done to determine if someone has ARDS. It's a process of elimination to determine if it's ARDS or if it's another condition. First, it has to be ruled out that the person is not suffering from pulmonary edema due to cardiovascular dysfunction or from pneumonia caused by bacteria. Some of the common testing that they use for ARDS is arterial blood gases, which indicate levels of O2 in the body. Chest x-ray will determine if there's fluid and how much. Sputum cultures, listening to the lungs, usually crackles or rails are indicative of fluid in the lungs. And then lab tests are run to determine the underlying cause and to see if there's an infection present. Treatment of ARDS includes O2 supplementation. Increasing O2 saturation is the #1 goal of treating ARDS, because without oxygen there is no life. So in the milder forms of ARDS, supplemental oxygen can be used, but with the more severe cases, the person has to go on to the mechanical ventilation because they cannot breathe on their own. Pharmacological interventions include antibiotics to help fight infection, pain medication to reduce pain and discomfort. Usually patients that are on a mechanical ventilator have to be sedated so they don't fight with the breathing apparatus that's run down the trachea. And patients are at high risk for developing DVT, so preventive measures have to be followed to help with that, and sometimes the patient has to be on anticoagulation therapy. Interventions that we will do as PTAs include postural drainage. The vibration and percussion techniques are going to help to loosen the mucus secretions from the airways. And prone positioning is going to help to increase the oxygenation, but it's also going to use gravity to facilitate clearing the airways either through suction or hopefully the patient can cough it up on their own. Both of these interventions fall under the practice pattern 6P or 6C, impairments and airway clearance dysfunction. We will also perform passive range of motion. This is going to help reduce the impact of functional and limitations due to immobility. Definitely once the person becomes a little more coherent, you would want to progress to active assistive range of motion, and then your main goal would be active range of motion to help them prepare for gait and also prevent muscle loss. One of the main techniques that or interventions that we'll be performing that's really important, which doesn't seem like a lot, but positioning. It's our job as therapists to educate the staff and the family the importance of a turning schedule to prevent skin breakdown. This is also going to help prevent tissue injury. It's going to help prevent contractures. It's going to increase the efficacy of body systems, and it's going to help reduce pressure over bony prominences. Positioning falls under the practice pattern of 7A, primary prevention and risk reduction for integumentary disorders. The prognosis of ARDS is difficult to determine during the early onset due to so many things happening at one time. Once the patient stabilizes, it's a little easier to determine. A third of people that develop ARDS will die. It has a very high mortality rate, especially if that's accompanied with sepsis. Sepsis is a really severe infection. It can be fungal and bacterial. And once it invades the body and it gets in the bloodstream, it triggers a body-wide inflammatory response, and it starts to affect different organs, eventually organ systems. And one study I read said that if a single organ is involved, there's an 80% chance of survival rate. Once it starts spreading to multiple organs, I think it said 4 or more, there's a 20% chance of survival rate. So it's very important to, through diagnostic testing, determine if there is an infection present. If there is, immediately starting antibiotics to help increase survival chances. Life after ARDS, people require extensive therapy from multiple disciplines. Physical therapy is involved, occupational to help with ADLs, respiratory to help, with all the lung damage that they sustain from being on a ventilator, and then speech therapy just to help with, eating, sometimes talking again due to damage that can be done to the vocal cords. Functional limitations include weight loss, significant muscle weakness, and lung damage or fibrosis due to being on a ventilator. 1 year after hospitalization, no person had to be on supplemental oxygen. 49% were at a high enough functioning level that they could return to work, but with a decreased quality in life. 5 years after hospitalization, there was even a more decrease in quality of life. People reported physical and psychological problems. A lot of them were socially isolated due to mental health problems or changes, which included psychotic episodes, and just a hard time reintegrating with society. They felt they were unable to fill societal roles, which this falls in the Nagy model of disability. So definitely as therapists, when we're dealing with someone that has suffered from ARDS, it's important to be compassionate, to be understanding. We need to understand more than just the disease process and mechanism. We need to understand the impact that it has on their emotional and psychological well-being. It's a terrible thing to have to go through, and a lot of people feel that they're alone in the recovery process. So definitely to be compassionate and understanding, and to be patient with anyone that's suffered ARDS. I have included a couple of resources if you would like to check that out. I definitely feel it's our job as therapists to educate ourselves, to understand as much as we can about ARDS, and and the problems our patients face.